Mainstream medicine appears to have overlooked a critical missing link in multiple sclerosis: vitamin D. This hormone-like vitamin is capable of safely interacting directly with the genome to modulate a variety of physiological functions, including aspects of immune function involved in autoimmune diseases like MS. 2 human clinical trials have demonstrated individuals with MS who used vitamin D tended to have fewer relapses and less inflammation. In a year-long vitamin D study, the recurrence rate of MS attacks was 27% lower compared to the baseline. In another large-dose vitamin D trial, the MS patients were given 28,000 to 280,000 international units per week, and they were found to have fewer active lesions during the 28-week study period. Omega-3 fatty acids are polyunsaturated fatty acids which cannot be synthesized in humans, and therefore they have to be provided via the diet. Both plant and animal foods are potential sources of omega-3s. For example, linolenic acid, which is found in flaxseed, flax oil, and preferably fish and fish oils, have high levels of EPA and DHA. A small study looking at the effects of omega-3 fatty acids on MS found that immune cells from treated patients and healthy controls produced significantly fewer pro-inflammatory cytokines after 3 months of treatment with 6 grams of fish oil per day. One double-blind placebo-controlled study exists to date looking at the effects of omega-3 fatty acids on MS. In the study, 312 patients were given either fish oil or olive oil or placebo for 2 years. The results of the trial exhibited a trend towards decreased disease severity in the omega-3 group. More recent studies have shown that MS patients who were given 10 grams of fish oil per day for 3 months exhibited significantly reduced levels of matrix metalloproteinase 9, a factor that's correlated with the disease progression. And also they had greater concentrations of omega-3 fatty acids in their red blood cell membranes. Other work has shown that MS patients, while on a low-fat diet with omega-3 fatty acid supplementation, experienced significantly reduced fatigue and lower relapse rate. Based on the clinical data and the patient accounts, omega-3 fatty acids appear to be well tolerated and safe with no adverse reports. Linoleic acid is converted to gamma-linoleic acid, a beneficial omega-3 fatty acid, after it's taken orally. However, the conversion is occasionally impaired, especially during inflammatory disease states. Gamma-linoleic acid has been found to quell inflammation, and research involving an animal model of MS has demonstrated that gamma-linoleic acid administration significantly improved clinical outcomes when compared to control treatments. Gamma-linoleic acid is found in borage oil and evening primrose oil. Some studies have shown a significantly reduced relapse rate and disease progression scores, while others have found no differences between the treatment and control group. A closer look at the data from these trials revealed that patients with the lower levels of disability at the beginning of the trial exhibited a smaller increase in disability over the study period than did the controls. In addition, the linoleic acid was found to reduce the severity and the duration of the MS episodes in patients at all levels of disease severity. Patients who have MS tend to have abnormally low levels of glutathione peroxidase, a powerful endogenous antioxidant. Researchers in Denmark conducted a small study where patients with MS were given an antioxidant mixture containing 2,000 micrograms of selenium, 2 grams of vitamin C, and 480 milligrams of vitamin E once a day for 5 weeks. Although glutathione peroxidase levels were initially lower in the patients with MS than in the normal controls, after 5 weeks of the antioxidant therapy, the levels of the antioxidant enzyme increased 5-fold, and the reported side effects were minimal. Oxidative stress plays an important role in the pathogenesis of multiple sclerosis, and this finding suggests the importance of antioxidants in the diet and the therapy of MS patients. An effective strategy for increasing the body's supply of the powerful antioxidant glutathione is taking the oral supplement N-acetylcysteine, a potent antioxidant that serves as a precursor to glutathione. N-acetylcysteine's potential benefit in the context of MS has been noted by some researchers. In a rodent model of MS, the N-acetylcysteine was able to diminish the clinical symptoms and the pathological evidence of central nervous system injury and to attenuate inflammation. Lipoic acid is a dietary supplement with antioxidant properties and it's been studied specifically in MS. Reactive oxygen species generated primarily by immune cells are implicated as being mediators of demyelination and nerve damage. Known to cross the blood-brain barrier, the lipoic acid decreases the activity of the intracellular adhesion molecule 1, and this is thought to play a role in the pathogenesis of MS. It's believed the ICAM1 and other adhesion molecules are responsible for allowing certain pro-inflammatory immune cells, like T lymphocytes, to enter the central nervous system, paving the way for induction or exacerbation of inflammation and tissue damage. In an animal MS model, lipoic acid produced a significant reduction of demyelination and infiltration of the central nervous system by the T lymphocytes. Other researchers have followed up on these studies. In a pilot clinical trial, 37 patients with MS were randomly assigned to receive various doses of lipoic acid, up to 2,400 mg per day, or placebo. After 2 weeks, the patients were assessed for the levels of ICAM1 and their tolerability of the high-dose lipoic acid. In addition to being well tolerated by the patients, the lipoic acid treatment was associated with reduced ICAM1 levels and reduced T-cell migration into the central nervous system. Coenzyme Q10 is an antioxidant and it's an essential part of healthy mitochondrial function and energy production, with potential usefulness for treating MS. Decreased levels of CoQ10 are associated with many disease states, including heart disease, cancer, and neurodegenerative diseases. CoQ10 was low in patients with MS. Several clinical trials of CoQ10 have been performed in neurodegenerative diseases such as Parkinson's disease, Huntington's disease, Alzheimer's disease, Friedreich's ataxia, and amyotrophic lateral sclerosis. CoQ10 is a powerful lipid-soluble antioxidant, and it's also capable of regenerating the antioxidant capacity of vitamin E in the body. Based on clinical evidence, CoQ10 appears to be well tolerated and safe, with potential usefulness in the management of MS. Some data suggest that patients with MS have abnormally low levels of B12 in their cerebrospinal fluid and blood serum. In fact, clinical vitamin B12 deficiency and MS share remarkable similar characteristics, occasionally rendering correct diagnosis difficult. Notably, B12 plays a key role in the generation of the myelin, and thus, for decades, integrative physicians have prescribed B12 injections for patients who have MS. Data suggests that patients who are given B12 supplements experience clinical improvements in their symptoms. For example, in the UK, researchers investigated the effects of 6 months of B12 at 1 mg per week injection on 138 patients with MS. The researchers concluded the clinical course of the patient with MS improved after beginning the B12 treatment. Ginkgo biloba extracts are primarily composed of flavonoids and terpenoids, and they've been reported to have properties that can influence the neural activity and improve cognitive performance. While control trials of the effects of Ginkgo biloba on cognitive function have generated inconsistent findings, more recent studies found encouraging results for patients with MS. In one study, patients received 120 mg of Ginkgo biloba extract or placebo twice a day for 12 weeks. Those patients who were taking Ginkgo biloba exhibited improved measures of attention and they reported fewer difficulties with memory. Epigallagocatechin gallate, or EGCG, is one of the main active ingredients of green tea, and it's been reported to have beneficial effects on the nervous and immune system. In an animal study of MS, the EGCG was found to prevent the severity of the clinical signs by decreasing inflammation and protecting the nerve cells. According to animal research, green tea has the ability to significantly increase the regulatory T cells, which are critical to providing balance to the immune system and suppressing autoimmunity. Curcumin is an active component of turmeric, a popular Indian spice. Lab studies have demonstrated curcumin has potent anti-inflammatory effects. A research group carrying out animal studies has demonstrated exciting findings that curcumin treatment resulted in significant reductions in disease severity and a reduction in the duration of acute attacks. In a follow-up study, lab researchers found curcumin not only suppressed disease severity, but also it was associated with a reduction in the level of interleukin-17, a cytokine that's been directly implicated in the progression of MS. Biotin is a water-soluble B-complex vitamin. It's sometimes referred to as vitamin B7. It participates in biochemical reactions catalyzed by decarboxylase enzymes, supporting energy production and fatty acid and myelin sheath synthesis. The adequate intake for biotin is 30 micrograms, and low to moderate amounts are common in multivitamin supplements. Biotin's role in neuron functioning is evidenced by its therapeutic effect in a rare genetic disease known as biotin-thiamine responsive basal ganglia disease. Children who are affected by this disease experience progressive neurological dysfunction, including speech and motor dysfunction, mental retardation, seizures, and possibly even death. Early treatment with biotin and thiamine, vitamin B1, appears to prevent the progression in most cases. More recently, researchers have been exploring biotin's potential for patients with MS. In the first clinical trial to demonstrate the potential of the high-dose biotin for MS, 23 patients with progressive MS were treated with 100 to 300 milligrams of biotin per day for an average of 9 months, while improvements were not seen for 2 to 8 months after initiating the biotin therapy, suggesting the biotin might instigate a slow and progressive repair of the MS nerve damage. Vision improved in all 4 participants with the MS-related optic nerve injury, and motor function and overall disability improved in 16 out of the 18 participants, or 89%, with prominent spinal cord involvement. In a randomized control trial, 154 patients with progressive MS received either 100 milligrams of biotin 3 times per day or placebo for 1 year. 12% of the biotin-treated subjects versus none of the placebo subjects exhibited improvements in the measures of their MS-related disability after 9 months, and it persisted through to the end of the trial. In addition, only 4% of the biotin-treated subjects, compared to 13% of the placebo subjects, had progressive worsening disability scores in the 9 months. Biotin levels in the cerebrospinal fluid of MS patients have been observed to be lower than those in healthy people, leading to the speculation that low biotin availability might contribute to the pathology of MS. Although the mechanism of biotin's availability to prevent or repair nerve damage is unknown, biotin might prevent progressive demyelination by improving mitochondrial function, increasing brain energy production, supporting myelin production by increasing lipid synthesis, and affecting gene expression. Biotin is excreted through the urinary system, and high doses appear to be well tolerated in trials to date. However, high doses of biotin can interfere with certain lab tests, including the thyroid function test, leading to a misdiagnosis of thyrotoxicosis. In addition, the possibility of teratogenicy has been suggested by animal research. Therefore, the safety of high-dose biotin in pregnancy is not established. Dr. Roy Swank first proposed a connection between increased consumption of saturated animal fat and the incidence of MS in the 50s. He conducted a study that enrolled 208 patients with MS in the early 50s, all of whom had experienced at least 2 acute relapses, and followed their progress over 34 years. In the study, patients who maintained the now termed Swank diet, which consists of less than 15 grams per day of saturated animal fat, 10 to 15 grams per day of vegetable oil, and 5 grams per day of cod liver oil, and 1 multivitamin. Long-term follow-up from the study indicates the patients who adhere to the Swank diet experienced reduced MS disease activity and progression of disability when compared to patients that didn't follow the regime. While these results are encouraging, the trial is criticised for its lack of proper control group and unblinded design. Nevertheless, the Swank diet remains one of the most popular complementary approaches to treating MS. Some of the recommendations: saturated fat should be less than 15 grams per day. Unsaturated fat should be approximately 20 to 50 grams per day. No red meat should be consumed during the first year. After the first year, a maximum of 3 ounces of red meat per week. Dairy products must have 1% butterfat or less. Processed foods containing saturated fat should not be eaten. A source of omega-3, a multivitamin, and a mineral supplement are recommended daily. Wheat, gluten, or dairy products are not restricted unless they're foods which cause allergic reactions. Because women often experience improvements of MS while pregnant, hormone therapy using estrogen has been studied as a treatment for the disease. In human studies, estriol treatment 8 mg per day in non-pregnant women with MS was associated with reduced lesion numbers and lesion volumes, and when treatment ceased, the values returned to the levels observed before the treatment. Patients who were given estriol also had enhanced cognitive function. With respect to the immune studies, the estriol was associated with reduced pro-inflammatory and increased anti-inflammatory cytokine production, and these changes correlated with the reduced formation of lesions. Other studies have shown that male MS patients who were treated with 10 mg of testosterone exhibited improved cognitive performance and reduced brain atrophy, although MRI data showed no change in lesion formation. In another similar study, testosterone treatment in males was associated with reduced production of inflammatory cytokines and increased production of neuroprotective factors. For more on herbs, supplements, and natural treatment plans, check out my website.